All right, we'll go ahead and get started. Well, good morning. Thank you all for joining us for our day, how we got here and where we're going, Cal OSHA standard updates. Presenting today will be Forensic Analytical's very own Director of Environmental Services, David Brinkerhoff. David has over 20 years of experience in the occupational health and safety, industrial hygiene, and hazardous building materials consulting industry. He has extensive and hazardous building materials experience and has been with our company for almost 15 years, David? 20 years maybe? But leading about that, we throughout the presentation today, you can ask any questions using the question feature in the box in the GoToWebinar platform. You can also chat us, and David also included a few poll options throughout the presentation as well. So keep your eye open for those and please interact with them. It makes the experience a little bit more user-friendly. So with that, I will hand it off with David.
Fantastic. Thank you very much, Taylor. All right, I'd like to start by just saying lead is a complicated issue. It's probably the most regulated environmental hazard in this country. We regulate in the air, in the water, in the soil, and in the dust, in our buildings, and our building materials. So there's a lot of information about lead. Today, really what I hope to do is kind of focus on a little bit of the history of lead, why it's a hazard, of how we got here regulatorily, and then focus on where we're going. There's a lot of changes in the world of lead, and specifically we're going to talk about the changes with the Cal OSHA construction standard. I will point out that there's also been changes made to the general industry standard from Cal OSHA. That's not the topic of this presentation. That's a different presentation. Today is just construction. So talking a little bit about lead. Lead has been used by humans for thousands of years, and it's actually one of the first instances of occupational disease that we have on record, people being sick from very high level lead exposures. One of the things we talk about sometimes is the Roman Empire and whether or not lead contributed to the fall of the Roman Empire. And we know that the Romans used lead in everything. They used it in their pipes and their dishes, cosmetics, their coins, paints. They even used what they called sugar of lead or lead acetate. They would add it to wine and foods to give it a sweet taste. So we don't know directly if this was the call that resulted in the fall of the Roman Empire, but we do know that it seems to have caused a lot of mental incompetence issues, a lot of declining birth rates, particularly with the ruling class that had a lot of really, really high exposures to lead. Not too many ago, somebody also hypothesized that Beethoven, the composer Beethoven, a lot of his health challenges may have been related to lead and high-level lead exposure. And somebody went and did some studies of his hair and found that sure enough, he had very high level of exposure to lead, which may have, at least in part, led to his death or some of his health problems. Today, we have kind of different exposures. We don't see those really, really, really high-level exposures from people putting lead on their cereal, right? But we still have a lot of exposure at a lower level, and the result of that is that the symptoms of exposure are a little bit more difficult to separate from other types of symptoms. So let's talk about today and kind of where we find lead. We still find lead all over the place. It's in paint, it's in glazings. We see flashings. Old stone or brick mortar can have lead. If you're in telecommunications, some of the wiring has lead shielding. We see lead in the soil all over the place related to historical use of lead in fuels. And we still use lead in some of our aviation fuels and some of our racing fuels. Also industrial contamination, battery factories and things can contaminate wide areas. We still see lead in some old solders, some old pipes. Everyone's heard of Flint, Michigan, and some of the issues around there. Consumer products can have lead in them. If you're into shooting or fishing or other types of things, you can have high levels of lead exposure. Some of the highest exposures that I've found to lead are in indoor shooting ranges, where they still use both lead in the primers and lead in the bullets. We see very, very high exposures, both from an inhalation standpoint, but also surfaces can be very highly contaminated. And then there's some traditional medicines, candies and things. So there's lots and lots of ways that we are still exposed to lead every day. And when we have exposures, it's difficult to point to a symptom and say, that's lead poisoning. Because we don't tend to see those types of symptoms. There are some very distinct symptoms of lead poisoning, but we very rarely see those. It tends to be much more common types of symptoms, things like high blood pressure, headaches, things that we all have, right? We have all had headaches. We've all had muscle pain or joint pain. So it can be very difficult to pin on lead exposure. And when it comes to children, lead is really, really devastating. It basically just lowers IQ points for children. So, and it can be difficult to, without testing blood in children, but it can lead to hearing issues or speech issues, delayed development, really, really devastating consequences for children that are exposed to lead. And these are things that can impact them for their entire lives. I'll talk a little bit more about that in a minute. And with that, we'll go to our first poll. Let's see, Taylor, do we have a poll going? There we go. So I'll read it out loud here. What year did it become illegal to add lead to paint? We got a couple of key dates there that people may be familiar with. Okay, we'll give it just a few more seconds. So far, 1978 seems to be the winner. A lot of us have heard of pre-78 housing. All right, and I think we're done. So the most common answer was A, 1978, and that is wrong. So it's actually legal to add lead, up to 90 parts per million of lead into paints today. At the federal level, there's been several laws which have reduced the amount of lead that is legal to put into paints. But today, on children's toys or any other type of material that's painted, you can still put 90 parts per million of lead into those materials. If we're talking about industrial primers or marine paints, we can have much higher levels of lead. All right, so here's kind of a brief history of how we got here. There's a lot more regulations than this, but I just kind of wanted to show, sort of a general timeline of how our understanding of the hazards related to lead and our regulation of these hazards has changed over time. So going all the way back to the 40s, in about the 40s, a lot of paints used all over the place contained up to about 50% lead. Very, very high levels of lead in some of the old paints. And a lot of that stuff is still around in old housing and old buildings. It wasn't until about, and shortly after that, in the 50s is when the paint manufacturers started to understand that there was some hazard related to people that were applying these paints, people that were exposed to this lead. So they started to make some changes. In the 70s is when we started to get some of our first big federal regulations. In 71, lead-based paint was banned in structures that receive federal funding. And lead-based paint, just as a little bit of background, that's defined as 5,000 parts per million. So we talked about 90 parts per million a minute ago is legal today. Lead-based paint, which is banned in child-occupied facilities, is 5,000 parts per million. But as I'll talk about in a little bit, none of that has to really do with health so much. In 71 is when OSHA also came out with their first lead regulation, and they set their PEL at 200 micrograms per cubic meter. So remember that number. We'll talk a little bit more. Today, that number is 50 micrograms per cubic meter, and we'll talk about where that's going next year. In the 70s is when we also started to regulate lead in water with the first version of the lead and copper rule. As we move through, there starts to be some focus on lead exposure to children, and this is where we get some of our regulations related to lead in dust or lead in soil. In 93, this is our current version of the OSHA Lead, or the OSHA Lead standard, is when we move the PEL from 200 down to 50, which is what we currently set. 2008, federal feds came out with their renovation, repair, and painting rule. This regulates people that do renovation, repair, or paint in housing, basically pre-78 housing where they have lead-based paint. And that rule is still in effect. As we start to get into the 2000s is when we really start to see movement in our understanding of the health impacts of lead. And this really kind of comes through from the CDC in some of their levels around children. And they first in 2012, they set a medical removal number for pregnant women at 10 micrograms per deciliter of blood. And then in 2012, they also came out and set their reference level for children at 5. And that reference level, that's not a safe level. That's just a level that represents the top couple percentage points of exposed children. But at that same time, they came out and said, particularly for children, there is no safe level of lead exposure. And then the last couple of years, we've had some of the things around water testing in schools and childcare facilities. There's a whole bunch more out there, but this is really, sort of how our understanding of the exposure has evolved over the last 40 or 50 years. And this is not, this is very, very much an ongoing issue. A couple of years ago, a study came out from Florida State University and Duke, and they tried to assess the impact on these historical exposures to lead to Americans, not just occupationally, but just the entire population. And in that study, they calculated that as of 2015, America has lost 824 million IQ points because of lead exposure, primarily exposure to lead and gas. 824 million IQ points lost based on lead exposure. And if you were born prior to about 96, there's about a 50-50 chance that at some point you were probably what we would today define as lead poisoned. If you were born in the 60s or 70s, something like 90% of children had blood lead above 10, which we would now consider a very, very serious exposure. And these exposures don't just go away. They lead to lifelong changes, or they can lead to lifelong changes. Things like cardiovascular disease or dementia are now starting to be potentially linked to past exposures to lead. So as a society, we're very much dealing with this historical legacy of lead exposure. Today, those exposures tend to be much, much, much lower as a result of all of these different regulations and efforts. All right, so where are we going? Changes everywhere. So starting in about 2021, 2022, we started to see both federal EPA, federal HUD, and federal OSHA all starting to move towards making changes in their standards related to lead. And all of these federal agencies move very, very slowly, but they've got different plans and different proposed rulemakings related to changing their lead regulations. So this is happening at a federal level at the same time that it's happening at the state level in California and also in many other states. Some of the recent changes at the federal level have to do with the TSCA regulations and how we define hazards in dust and also our clearance level. And this really has to do with us doing risk assessments or lead hazard screening or abatement clearances, and mostly in pre-78 homes and childcare facilities. In California, that can also include public buildings. But in 2019 and 2021, they reduced these numbers. And you can see here, when we're talking about lead in dust on the floors, they reduced the number from 10 micrograms per square foot. I don't have it here. They actually removed it changed it from 40 down to 10, and they're proposing to change that down to non-reportable. So there was a Ninth Court of Appeals decision that came out and said that these numbers needed to be health-based. And so going back to this idea that there's no safe level of exposure, they're proposing that we set our hazard levels as non-detect for lead on floors and also non-detect for lead on windowsills. So that's a major change when we're evaluating lead hazards, particularly focused on children. And then when we do an abatement project, the clearance levels, they did say when it comes to clearances, we have to take into account feasibility, right? It's not feasible necessarily to get down to non-detect. So they set these very, very low levels, moving from the current number of 10 down to 3 for floors. And these are proposed numbers, and moving from 100 to 20 on windowsills and 400 to 25 on window troughs. And these are, EPA's come out and said that we believe these are the lowest we can get that's achievable in the context of doing an abatement. So this is in process. These are proposed numbers at this point, but this is where federal EPA seems to be going. And California will have to follow those numbers as they did when they made the changes in 2019 and 2021. Another big change coming from federal EPA and also HUD is a change to the definition of lead-based paint. Last year, there was a workshop to start to go through this idea of what does lead paint mean and do we need to redefine it? When lead-based paint was, that definition was set way back in the 70s, that was really based on technical considerations. What could we identify from a lab standpoint? What can we reliably measure in paint? It has nothing to do with health. So when we talk about lead-based paint and lead-based paint in pre-78 homes, that number, that 5,000 parts per million or 0.5% by weight, is not a health-based number. It was just the best they could do at the time back in the 70s. So now EPA and HUD are looking at changing that number, and that could have impacts to the federal renovation, repair, and painting program, some of the HUD rules, some of the things that use that definition of lead-based paint. One thing, well, I won't say that yet. All right, some other changes. Here in California, in 2019, AB 35 passed. This law establishes the Occupational Lead Poisoning Prevention Program under CDPH. And basically what this means is if an adult is identified as having been lead poisoned, generally above 20 micrograms per deciliter, then that person, that result gets reported to Cal OSHA, and that person goes into a registry. So this is really an effort between CDPH, California Department of Public Health, and Cal OSHA to share information about lead poisoning. Another change that was approved in 2022 is a change to Title 17. This is our big regulation in California that identifies those hazard levels and those clearance levels and some other things. But California Department of Public Health is looking to make a major update to this regulation, first one since 2018. This regulation, the way it's currently proposed, would do a whole bunch of things. Number one, it would take that federal renovation, repair, and painting rule, and it would bring it into California. So California would be in charge of making sure that rule is followed in California. And to do that, CDPH would establish a renovation section within CDPH to oversee that rule. It would also focus on some training and certification requirements, accreditation of trainers, and it would put teeth in the law. So they've proposed some penalties that are pretty substantial for violating these laws. And as part of trying to get people to follow the law, there's also a requirement that they reach out to SEAL, Contractor State License Board, to educate contractors that work in these type of buildings and have these potential that are subject to this regulation. Here locally in the Bay Area, City of Oakland came out with a new rule. This happened in summer of last year, where they're now requiring permits for all projects where paint will be disturbed on pre-78 homes, childcare facilities, preschools, that kind of thing, where children may be exposed. So if you want to paint your older house or paint your childcare facility, you have to get a permit from the City of Oakland. And as part of that, you've got to have a licensed person go do a lead risk assessment. There are some exemptions to that, and they're listed there. If you're an owner or doing small projects or it's an emergency, you're exempt to the permit requirement. But this is the first sort of citywide regulation we've seen that's focused on lead. And there's a whole bunch of problems with it. I've got a little quote there on the slide, but on the website there, they say, since the implementation of lead paint bans in 1978, new construction no longer contains lead-contaminated paints, surfaces, and coated materials. Construction on modern buildings where lead isn't present is exempt from the RRP rule. That last sentence I agree with. If there's no lead present, then we're fine. But as we discussed earlier, we know that lead is still added to paint, and we know that new construction is subject to the new Cal OSHA regulations. So there's some confusion at the city level there in Oakland about hazards related to lead. And with that, we'll get on to the main event. So Cal OSHA has updated their lead and construction standard, HCCR 1532.1. Before we get into the details, we'll start with another poll. How much lead has to be in paint for the Cal OSHA lead and construction standard to apply? 90 parts per million, 600 parts per million, 5,000 parts per million, or any amount of lead? Okay, so 67% of people were correct. The Cal OSHA construction standard applies to any amount of lead, both the existing standard and the new standard that's coming out next year. And here's this is from the very first section of the standard. You can see this section applies to all construction work where an employee may be occupationally exposed to lead. And they go on to define some of those areas where that exposure might occur: during demolition or salvage, during removal or encapsulation of materials that contain lead, new construction, very clear here, installation of products that contain lead, cleanup of lead contamination, transport, disposal, storage, and also maintenance operations. So anywhere that you have an employee that may be occupationally exposed to lead, some part of this standard applies. So how did we get here? Cal OSHA has been trying to pass this rule for 13 years. The original, the current construction standard went into effect back in 1993. In 2010, CDPH made a recommendation to Cal OSHA about some updates, and it's taken 13 years for this finally to get through for drafting, comment periods, and finally to be passed. And again, this is construction standard, but this is also the general industry safety standard. And here's kind of the process of how this works. So the standard gets drafted, they have a series of public hearings, and then they have some comment periods. So for this standard, the comment periods were back in the beginning and summer of 2023. We went through several comment periods. And just last month, on the 15th of February, the OSHA board voted to approve the standard. And it wasn't a unanimous approval. I believe the vote was 5-2. So not everybody was on board with approving this standard, including some of the folks in the IH industry. There was a lot of pushback with this being, too much too quick and maybe not achievable. So not unanimous in the passing of this. Where this currently stands is the standard is now being reviewed by the Office of Administrative Law, and from what I've heard from Cal OSHA, there's really no expectations that there's going to be any issues with that review. Assuming that review passes, they expect this law goes into effect January 1 of next year. So you've got a little bit of time before this law goes into effect. So let's get into the details. The rest of this is going to be pretty detailed. So here we go. Section B in definitions, not a lot changed here. But they did put in a definition, two important things. So this definition of altering and disturbing, and they give a whole bunch of examples of the types of projects or tasks that might result in significant lead exposure. It's important to note that this definition doesn't apply to scope. So I showed you the scope a minute ago, and that applies to any occupational exposure to lead. This particular definition only applies if you've got somebody that's medically removed for being overexposed to lead. They can't do this stuff. And the same goes for lead-based paint. The only place where OSHA defines lead-based paint is if you have somebody that's been occupationally or been medically removed because of lead exposure. They can't do this altering or disturbing on lead-based paint. So it's an interesting definition, but doesn't provide us a whole lot of help in interpreting the regulation. One of the big things is they finally identified trigger tasks. In the industry, we've been calling them trigger tasks for forever, since 1993. Now in the standard, they're actually called trigger tasks, and we'll go through those in a little bit more detail. Here's the big change. So the changes to the permissible exposure limit and the action level. Currently, the PEL is 50 milligrams per cubic meter. That's going to be reduced to 10. And the action level is currently 30 and going to be reduced to 2. So what does that mean? The permissible exposure limit, that's the level that we can expose, or as an employer, you can expose your employee to 8 hours a day over a working lifetime. The action level is the point at which we have to take some kind of action. Generally, it's going to be training. It might be medical surveillance or blood testing. But once we hit that action level, we have to do something. And those numbers have now gone way, way, way down. Before we were at 30, that's a fairly high exposure. Now we're at 2. And the thought is that in the data that we have is that it's very, very easy to hit that 2, doing fairly routine things in the construction industry. Talk a little bit more about that in a minute. But another change that they made is they now have a reference to section 5155. And for those that don't spend a lot of time in OSHA regs, this is the section that has the whole list of permissible exposure limits for all of the things that OSHA regulates. And what they did in the new standard is they say you must calculate your 8-hour time-weighted average in accordance with that, with the appendix in that section. So what does that mean? So if you go to the appendix, this is what it says. It tells you how to do your time-weighted average calculation. That's pretty straightforward. But what it says here is this next section. For multiple substances with independent health effects, an independent comparison for each time-weighted average shall be made. And then it says additive health effects. In the absence of information to the contrary, the adverse health effects of exposure to 2 or more toxic materials during the workday shall be considered additive. And the following formula shall be used for calculating the exposure, how much you're going to be exposed to during the day. So what they're saying here is you have to take into consideration other exposures that might impact similar body systems. So before we talk about what that means, let's do one more poll. What hazardous compounds, what else do we find in paint besides lead? A, is it asbestos? B, solvents, things like benzene, ethylbenzene, toluene, other heavy metals besides lead, or all of the above? All right, this one's easy. Well, maybe not so easy. All right, pretty easy. So 90% of you, I'll let this finish right up. All right, 85% believe that it's all of the above, and that's correct. There's all kinds of things in paints, both historically and currently, and we know that this is an issue if we look at painters. If you look at painters and their rate of cancer, we know that painters, on average, have a significantly higher rate of bladder cancer than the general population. About 30% higher than the average for bladder cancer. We also know that painters have higher than average rates of lung cancer, stomach cancer, esophageal cancer, and also mesothelioma. So we think that those higher prevalence of cancer rates are probably due to a lot of these other exposures in paints. We always think about lead, but we don't think about a lot of the other things that go into paints, either when we're applying them or when we're removing them. All right, so let's going back to how we evaluate the time weighted average under the appendix in section 5155. Let me give you an example. So if you look at the basis of the lead PEL, it says that lead impacts the central nervous system, the peripheral nervous system, gastrointestinal, and also kidneys. So if we think about what other things are present in lead, and here's a list, right? We find mercury, cadmium, and manganese in lead. If we're abating lead, we might be using products that contain methylene chloride, maybe arsenic's involved, but I just picked one, cadmium. Cadmium also impacts kidneys, just like lead. So we have to now, under OSHA, take into account the additive effect. So let's say we do an exposure assessment, and I get this result of, I've got a 6 micrograms per cubic meter versus my PEL of 10, right? So I'm 60% of my PEL for lead. And my cadmium, let's say I'm a little bit less than 50%. I'm 2.4 versus a PEL of 5. When I add those up, as stated in the appendix, I come up with an overexposure. So I can be exposed below the PEL for lead and below the PEL for cadmium, but when I take into account the additive effects of those exposures, I'm overexposed according to Cal OSHA. So this is a big deal, right? I mean, like typically we go out and we do a lead survey and you've got lead or you don't, we do an exposure assessment. It's not very often that we see people evaluating other things that may be in the paints or really looking at these additive effects. So potentially a pretty big issue. All right, trigger tasks. Okay, so we've always had this trigger task process in the standard, and we've always called them trigger tasks, even though that language didn't exist or doesn't exist in the current standard. But in the new standard, they do call them trigger tasks, and they have changed a little bit. So for those that aren't familiar with this process, what it is Cal OSHA says if you're doing a certain task, you have to presume a certain level of exposure. And so here's an example. For level 1, manual demolition. So if you're doing manual demolition and there's any amount of lead in the materials that are impacted, you're required to presume that employee's exposure is going to be above the PEL, which means that person has to be in a respirator, they have to have the proper training, they have to have a compliance plan. If they're going to be in a respirator, they've got to have medical clearance, they've got to have fit testing, all of those things in order to start the job. You have to start by presuming that level of exposure. And then you can do an exposure assessment and downgrade to a lower level of protection if that's appropriate. And so that level 1, where I have to assume I'm above the PEL, but not more than above 10 times the PEL, that means I have to wear a half-face respirator generally, manual demolition, manual scraping, heat gun. All right, level 2, and this is what's changed a little bit. So manual sanding used to be in level 1, and that's now moved to level 2. Level 2 is also added grinding. And so basically what that means, if I'm doing any sanding, grinding, or spray painting with lead paint, and there's any amount of lead in the paint, I have to assume those employees are exposed more than 10 times the PEL. That means full face respirator, and all the other things that go along with that, compliance plan, training, regulated areas, all that stuff. And then again, I can do my exposure assessment, and if appropriate, I can downgrade. And then level 3 is all these other things, burning lead, for doing cutting or blasting. I now have to presume my employees are exposed more than 50 times the PEL, and that means supplied air or SCBA respirators, very, very high level of respiratory protection that I am required to start in at the beginning of the job. So this is kind of one of those things that has historically gotten ignored a little bit. Cal OSHA has cleaned this up a little bit, moved around some of these tasks in the different levels, but this continues to be required under the new standard. And if we're doing any of these trigger tasks, I mentioned most of these, but you're talking about respirators, potentially protective clothing if you're above 30, Clean change areas. If you're doing a level 3 trigger task, you might need to have shower facilities. You'll always need to have clean eating areas. Work has to be done within a regulated area to keep other employees out. Medical surveillance, blood testing, training, and a lead compliance plan. So if you're going to be doing any of these tasks and there's any amount of lead present, there's a whole bunch of requirements that you've got to follow just to start the job. Talking about exposure assessment, there's a somewhat different requirement around monitoring frequency. So the amount of exposure assessment, exposure monitoring you have to do is based on the results of your initial determination. So if you do your initial determination, you're less than the action level, you're done, unless something changes, right? Unless you change equipment process, personnel, level of training, anything like that. If you're above the action level but less than 30, you've got to repeat it every once a year. If you're greater than 30 but less than 50, you've got to do it every 6 months. And if you're above 50, you've got to do quarterly monitoring. And that monitoring has to continue until you get 2 consecutive measurements taking at least 7 days apart that are below that trigger level. So if you get a measurement above 50, you've got to do that quarterly until you get 2 measurements below 50 that are 7 days apart. And then again, this all resets if you have a change to personnel, training, equipment, process, controls. You've got to re-establish your initial determination. So new requirements related to the accuracy of measurement. So we used to say, or the standard used to say, you had to be the accuracy of your air sampling or your bulk sampling, or your air sampling specifically needed to be plus or minus 25% at the action level of 30. The new standard says you've got to be plus or minus 20% at the action level of 2. And then for bulk samples, plus or minus 20% at 600 parts per million. So they're requiring a much more accurate type of analysis than they did previously, which is doable. It requires us probably to go to a different method that already exists, but we probably have to move away from Flame AA and move into ICP as a method, which isn't a huge impacting cost. It does cost more money, but I think where the impact may be is in lab capacity. I was talking to one of the guys that works for the lab, and to bring a new ICP device online costs about $200,000. It takes like a year with all the approvals and everything. So I don't know that it's likely, but I think it's possible that in the short term we may see issues around lab capacity. We're certainly going to see a little more cost to get the analysis done. Compliance programs. So anytime you've got exposure above the PEL, so if you're doing one of those trigger tasks or if you measure exposure above the PEL, you're required to have a written compliance program. And that's a pretty detailed document. And here's some of the language around it, right? You've got to talk about any engineering goals and work practices that you considered in meeting the PEL, but didn't implement. So if you thought about using local exhaust ventilation, but decided that wasn't feasible, you have to write that into your lead compliance program and explain why you determined that wasn't feasible. That program has updated every 6 months, and those updates have to be documented in writing. So you've got to pick that program back up every 6 months. You've got to keep records around how you did that update process and who did that. Respirators. This is one of the changes that was made during the comment period, where initially the first proposed version of the standard said no N95 respirators. And they changed that to say you can use N100 or the equivalent 100 level filtering face piece respirators. In my experience, these pretty rarely do I see these used anywhere, but they do exist out there. So if you wanted to go with a more disposable type respirator, N100s are equivalent to your traditional half-face respirator. So you could use those. And maybe this is why they got rid of or they don't allow you to use the N95s anymore. I was on my way to give a similar presentation, and I pulled up to a stoplight and I saw this picture here. I took this picture out of my car window. This was a painter, I think, and his respirator was hanging off the back of his truck. So I think Kalos is trying to get rid of that. Protective clothing. So we need to provide, or employers need to provide to their employees protective clothing if you're above 30. So we've got an action level of 2, we've got a PEL of 10, and now we've got a requirement for protective clothing at 30, regardless of respirator use. This one's interesting. So there's always been hygiene requirements around lead, but they've changed a little bit. We used to say we need to have clean food, clean eating areas if we had exposure above the PEL. Now, any occupational exposure, we've got to have clean eating areas. Appropriate number of washing facilities with special cleansing compounds. They don't define what that means, but you've got to have cleansing compounds that are effective for lead dust, presumably. In this last section, I think is kind of interesting. So the employer shall ensure that employees exposed to lead wash their hands, exposed arms, and face prior to entering eating areas, eating, drinking, smoking, or applying cosmetics, and at the end of their shift. So as an employer, how do you ensure that your employee has done that? Do you have to assign somebody to be the hand washing or the arm washing police? Do you have to document it? How do you know your employees are following this requirement? Showers. So we used to say showers were required above the PEL. The trigger is the same. The old PEL was 50. Now we still say showers are required if we're above 50 micrograms per cubic meter, regardless of respirator use. Also, if you're doing level 3 trigger tasks, so that's your cutting, burning, abrasive blasting, that kind of stuff, you've got to have a shower, unless you can demonstrate that it's not feasible to do so. And then the employer shall ensure where there's a shower facility that employees shower at the end of the work shift. So again, how do you document? How do you communicate to Cal OSHA that I know my employees are actually using the showers that I have set up on the site? But it's clear from the standard that it's the employer's duty to ensure that the employees are following those hygiene requirements. All right, medical surveillance. So this one gets quite complicated. So blood testing to start. So when do we have to test employees' blood? Well, you have to do it if there's exposure above that action level of 2, or if they're performing a trigger task, unless you've done a negative exposure determination, unless they're not doing it for more than 30 days in 1 year, and they're not exposed above 10 on any one day, or if they've had a blood test in the previous 2 months. So that's a lot to figure out. It's a lot to track. But basically, if you've got exposures on a regular basis that are going to be above the action level of 2, or if they're doing trigger tasks, you need an initial blood draw. You may also be required to have a medical surveillance program. And again, this is for employees exposed above the action level or that are doing trigger tasks, unless they're not exposed more than 30 days in 1 year, or any day above 10, or they're only doing level 1 trigger tasks for less than 10 days in any 12 months. So again, a lot to track. How do you know that Bob is only doing 9 days of level trigger task 1 work, not 10? You would need to keep track of all that if you made the decision for somebody doing this type of work to not put them in a medical surveillance program. And then there's again, kind of a complicated schedule for lead testing. So if you've got an employee that falls into that category where they're required to be offered medical surveillance, you've got to do their blood testing prior to the job, at least every month for the first 6 months, and then every 6 months. You also have to do it every 2 months for the first 6 months after they change a task. So what does that mean? If they go from one job to another, where there's different amounts lead in the paint, or maybe they're demoing different things. Is that a different task where you'll be required to restart your clock on the blood testing? And then if you start to get hits, they've got to go every 2 months if you're greater than 10 but less than 20, monthly if they're greater than 20 or medically removed, and at least monthly if they're doing level 3 trigger tasks. For those folks doing torch cutting or lead burning or abrasive blasting, that kind of stuff, they need to have monthly blood lead testing. And here's kind of a summary of that schedule. So you can see that's basically all the things I just said. Again, lots to track, lots to pay attention to if you've got employees that are required to be surveilled under this plan, and then under the standard. And then one other thing is if you do get employees that are above 10, so medical removal is 20. Well, medical removal is a little bit more complicated than that, but we'll call it 20 for a minute. But if you have employees above 10 micrograms per deciliter, you have to have a written program that, or written response plan that talks about how you're going to lower that employee's exposure to lead. So another written program if you have employees that end up with blood lead above 10. All right, so here's our medical removal. Again, a little bit more complicated. So above 30 micrograms per deciliter, or 2 in a row above 20, or an average over the last 6 months over 20, unless the last is 15, or if a doctor says so. So again, quite complicated. This is a lot to track, a lot to figure out if you've got a number of employees that are subject to surveillance. And again, if you're above 10, you got to have that written response plan and additional training as well to correct the employee's behavior to reduce their exposure. And this is the only section where that we started out early on talking about the definition of altering or disturbing and all of those things that are altering or disturbing. And this is the only section that definition applies to, is if I've got somebody that's got to be medically removed, they cannot do any of that altering or disturbing work to lead-based paint. And again, this is the only place that Cal OSHA defines lead-based paint at 5,000 parts per million or 0.5% by weight. There's a number of scenarios in which you have to offer medical consultations to your employees, in addition to the surveillance that you're required to do. If you have exposures above the action level, so the employer shall post the following warning sign in each regulated area and in each work area where the employee's exposure is at or above the action level. So any job above 2 has to be in a regulated area and has to have signs. This used to be 200 micrograms per cubic meter, 4 times the PEL. Then they moved it down to the PEL. Now it's at the action level. So a lot of jobs are going to be done with signage and in regulated areas. And that kind of brings us to the end. Here's my cheat sheet. There's a lot of different numbers and things. So here's kind of a quick summary of what you've got to do as an employer. So if you have any occupational exposure to any amount of lead, some level of training has to be completed for those employees. They have to be aware of the hazard. You have to have clean hygiene facilities, and you have to document that your employees are using them. And you have to disallow food and beverages, cosmetics, tobacco, that kind of stuff in work areas, and make sure that employees clean up before they eat or apply cosmetics or smoke. If you're above the action level, that 2 micrograms per cubic meter down from 30, you may have to do some initial blood testing if you're doing it enough times during the year. You may have to do medical surveillance. You may have to offer your employees medical consultation. There's an additional level of training that has to be completed for employees. Their work has to be done within regulated areas with signs up, and you have to validate their exposures. You have to do that exposure assessment on some frequency. If they have exposure above the PEL or they're doing any of those trigger tasks, in addition to all the other things, you've got to have clean lunchrooms, clean change areas, showers, unless you can determine that they're infeasible, regulated areas, and then that written lead compliance program. If you hit 30, the old action level, now you have to have protective clothing in addition. And if you hit 50, the old PEL, now you've got to have showers, which were already required if you were doing a level 3 trigger task. So there's kind of your quick cheat sheet, and that really brings us to the end. We'll open it up for questions in just a moment, but some of the things that I've taken away from reviewing the standard is, man, this is complex. This is one of the most complex Cal OSHA standards that are out there. There's a lot of nuance. There's a lot, I've read the thing, I don't know how many times, and I'm still finding myself having to go back and double check things because it's a very complicated regulation. And it's conservative, right? These are much, much lower numbers. These numbers have come way, way, way down from where they are today, or they will be coming way down where they are today, which is going to bring a lot of trades into the lead world that maybe didn't consider themselves subject to this regulation. If you're a painter and you've got to demo a little bit of sheetrock to get to a pipe, are you now doing a trigger task? And you have to do that work in a respirator with a lead compliance plan, with exposure assessments, all that stuff, right? If you're a roofer and you're demoing a roof that's got a little bit of flashing that's made from lead, are you doing a trigger task, and are you subject to all the requirements of that? So a lot to be figured out there. It's going to be costly. There's a lot of additional cost for employers related to training and all this medical work, exposure assessments. As a consultant, we're going to be paying more for doing the surveys and the exposure assessments. And maybe we see what City of Oakland's doing and more requirements around permits, which is additional cost. And then the big question everyone asks is, man, is this going to be enforced? And, like any Cal OSHA standard, that's the big question. We know Cal OSHA doesn't have enough staff to enforce the regulations thoroughly, but also know that they're making a big push there. And this isn't the only new standard from Cal OSHA. There's a number of standards that have come out this year or will be coming out. So if Cal OSHA is able to hire up inspectors, we may see more enforcement there. And with that, I'm done. I will open it up for questions. Taylor, do we have any questions?
We do. Thank you, David. The first one that came in is for trigger tasks. Is it based off of any amount of lead in the material?
Yeah. So there's this number in the standard of 600 parts per million. And basically what it says is when you're doing your initial determination, if you have less than 600 parts per million in your material, then that is sufficient to have a negative initial determination, meaning you don't have to do a lot of the stuff in the standard if you're less than 600 parts per million. But then it goes on to say that does not apply to trigger tasks. So if you're doing a non-trigger task and you're less than 600 parts per million, a lot of it goes away. But you can't use that 600 parts per million for the trigger task. Any amount of lead triggers all the requirements around the trigger tasks.
Thank you. And just as a reminder for folks, I saw a few hands go up. In the question pane in the right-hand side of the GoToWebinar platform, go ahead and enter all of your questions in there. All right, the next question that came in was, is the compliance program company-wide or job-specific?
Good question, right? It requires you to take into account any controls that you thought about, right? So to me, that's really, in a lot of ways, probably has to be job specific, depending on what your job is, right? If you're, kind of doing the same thing every day, and your employees have the same type of exposure, doing the same types of tasks on a daily basis, then I think it would be company specific. If you are going site to site, or maybe you're an abatement contractor, and every day is different, the amount of lead is different, maybe what you're demoing is different, maybe what you're doing is different, then I think you have to update it to be more job specific.
All right.
Because it's the plan is really describing how you're going to protect employees from lead exposure, which is really, really tied to what they're doing and what the material is.
Okay. What is an example of a non-trigger task, if you could give a few or one?
Yeah, non-trigger tasks. So soil is one we see all the time, right? If I'm digging in soil that has lead contamination, then that's it's not a trigger task. I'm not doing manual demolition or sanding or cutting or blasting, but I still have potential exposure. Another example could be maybe removing, well, let's stick with soil. That's the big one we see a lot, is digging soil.
All right. And what if something is not on the trigger task, like cutting lead with a knife?
Yeah, interesting. So if it's not on the trigger task, so if we look at the definition of trigger tasks, it says cutting. It doesn't really specify what kind of cutting that is. So whether cutting with a knife is a trigger task is a different discussion. But if you're not doing a trigger task, you're not required to presume exposure above the PEL. So let's take the soil example, right? So I've got employees, they're going to be digging in soil that has some amount of lead contamination in it. I don't have to start with the presumption that they're above the PEL. So I don't have to start them in a respirator, in a regulated area, with a lead compliance plan. Now the risk is that I still have to do my exposure assessment. So the risk is I say, I don't think the exposure is going to be high. We're not going to put you in a suit and respirator to go dig. And we do our exposure assessments. If I then get a result that's above the PEL, my risk is that I've documented that I've overexposed somebody. So you want to make sure you're making good decisions on that. But the standard doesn't require you to put a person in a suit and respirator that's not doing a trigger task. You have to train them. You have to do the exposure assessment, but it's all about what that starting presumption of exposure is.
All right, thank you. Do you have any resources for negative exposure assessments?
So, yeah, so Cal OSHA lets you use something called objective data, and it's defined in the standard what that means. And basically, if there's an industry or resource or something that shows that, while doing this task with this material, we have all this data that shows we can't overexpose employees. You can rely on that. The problem is it for the most part doesn't exist. A lot of our work, particularly in construction, every day is different. Every material is different. Every task is different. So most often people are doing exposure assessments in real time. Right? I've got a new job. I've got to go do some welding on some beams that were previously coated with lead-based paint. We've got to go do an exposure assessment on that guy. Now you can use those exposure assessments over time, right? They're generally good for a year if you're doing the same thing. The trick is the standard says if there's a change to personnel, process, material, level of training, if there's a change to any of that stuff, your exposure assessment is no good. And you have to start over. So, one of the things I've been talking to clients about is, you may take this time, right, before the standard goes into place and start to generate some data. What are the things we do? Okay, well, we're soldering on a regular basis, or we're welding on beams on a regular basis, or we're doing demo on a regular basis. You can start to get some of that data now, and you can rely on that for at least a year as you implement the stricter standards. That way, when we get into the new standards, you may have good data that shows, hey, if we're digging in soil, there's that example. If we're going to dig in soil and it's less than 150 parts per million lead, we know that as long as we have reasonable dust control, we're not going to overexpose our people. And you can rely on that if you have similar personnel, tasks, jobs, all that kind of stuff. You can rely on that data.
All right. And I know we're running out of time here, but this final question I don't think will take much time. Is cutting walls containing lead with a reciprocating saw considered cutting? Yeah.
Yep. So if we go back, well, you might consider it manual demolition, but it's those trigger task definitions are a little bit broad, and so you have to make some interpretations. So, cutting with a skill saw, that's To me, that sounds a little bit more like manual demolition than torch cutting, which is what the level 3 trigger task is.
All right, and that's it. So I know we're out of time here today, but if you have any further questions, we will be sending out David's contact information so you can follow up with any questions that do come up. We will also be sending out a recording of today's presentation should any other clarifying questions come up that you want to resource material for. But thank you all very much for joining. We hope you have a great rest of your day, and we hope you'll join us on the next one. Take care. Thanks, David.
Thanks all. Stay safe.